Probably for the VA claims process, the most study that most the physicians are going to look at are going to be the X-rays.
Open ranks, on!
Hey, what's happening? This is Jerome, president and founder of Open Ranks Nurse Consulting, and today I have on the channel with us Dr. Drew Mosier. He is a radiologist here at Madigan Army Medical Center. I met Dr. Mosier in my reserve unit. I always noticed that he was very willing and able, obviously, to discuss his craft, the radiology craft. And so today, I want him to talk to you guys about the findings of what is really a radiology study. What are the different components of a radiology study? How do you approach the doctor, your primary care physician, your treating physician, in order to get more understanding of it, so this way you can advocate for yourself. So as we tee this up, Doc, I want you to do just a quick, brief introduction to yourself, and then we'll get into the rest of the discussion. You got the floor, Doc.
Hey, thanks a lot, Jerome. I appreciate it. So yeah, my name is Andrew Mosier. I'm currently a radiologist working at Madigan Army Medical Center. I had done actually my radiology training at Madigan Army Medical Center, and then was sent to a year to do diagnostic studies at Fort Knox. Then I had the opportunity to go to Cleveland Clinic and do a one-year fellowship. Got back here to Madigan, and they said, welcome, and we're going to have you go deploy for 9 months in Djibouti. And then I came back to Madigan, where I spent half my time active side, half my time reserve side. And currently I'm working still as a civilian radiologist at Madigan and just about to close out my reserve career in the Army. But with that said, that will just lead farther into radiology.
Well, you're almost done. You're about to retire here shortly, correct, sir?
Yep. Yesterday, I got to 20 years.
Oh, man, congratulations. Congratulations. I know that was a big feat, but we're glad to have you here, and I'm quite sure that the audience will definitely appreciate the value that you can bring. So Doc, let me ask a couple of questions, and let me just tee this up for the audience. Many veterans and service members have kind of sent me messages on the side and say, "Hey, look, I'm trying to advocate for myself with the medical record. I really, first of all, there's a couple of problems with me understanding the medical record. What are the major components of it? I hear that I have to have, objective findings. I really don't know what that means. There's a lot of medical ease inside of the record that I don't understand, to include the radiology studies, which I just skip over and don't add as evidence because I can't understand what is being said there." So could you kind of tee up and kind of help us walk through at a 25,000 foot view, because I know that you can go down to the to the lower levels, how someone like a veteran and a service member can at least begin to approach understanding the medical aspect of the radiology studies? Like, what are the different types, things of that nature?
Yeah, sure. So we're going to, in radiology, perform about 5 basic studies, and I'll name them, and then I'll go back and talk about the importance of each one, especially in regard to the VA claims process, which is what I hear to be one of the main questions. And so we're going to perform X-rays, which are a 2-dimensional, either back to front or side to side or angled look, oftentimes for the VA claims process at a joint, the elbow, the knee, the wrist, the ankle, the hips. And we're going to gather information based upon a 2-dimensional image and give an interpretation for that. The 3-dimensional version would be the CAT scan. And oftentimes the CAT scan in the past hasn't been used a lot to look at joint injuries, but more for emergency type purposes, for the chest, for chest pain, or for the abdomen, pelvis, for that pain in that region. But it is playing a tiny bit more role lately in orthopedic or joint imaging, oftentimes centered around fractures or joint replacements. And then we have MRI. MRI is basically going to be used for joints to further look into joint injuries on the ligament or tendon level. It also can be used on the soft tissue level to look at nerves or nerve structures such as the brain and spinal cord. We're going to have ultrasound. Ultrasound is not going to play a terribly large role in the VA claims process per se, because oftentimes we're looking at organs inside the abdomen and pelvis. And it's yet to find its realm to be very diagnostic in the musculoskeletal region.
Mm.
And then we got bone scan. Bone scan is often used to look for stress fractures. And obviously, long marches can create stress fractures. Obviously, there's other reasons militarily that we could obtain a stress fracture either in our lower shin region or in the bones of our feet. And but probably for the VA claims process, the study that most the physicians are going to look at are going to be the X-rays. In large part because the physicians in the VA claims process probably understand X-ray the best, since they aren't radiologists per se, but have had some radiology training in medical school. And also because if they can pull open an X-ray, they can see for themselves what we're talking about on 1 to 5 images. Whereas if they pull open a CAT scan or an MRI, they're going to be left scrolling through 500 to 7,000 images, of which they probably, one, don't have the time to do, or two, don't have the eye to pick out the exact 1 out of 7,000 images that we're talking about something could be going on.
Close ranks, march!